with my peers, we joke and we say that our families are in some ways more conservative than the families who are living in places like Bombay and Delhi and Hyderabad today. Our families move, so for example, in my family in the 70s, to the United States, and they come with them sort of that mindset of this is what Indian values are like. And they sort of don't want to necessarily accept Western ideals or Western motives. So they stay stuck in that 1970s idea of what Indian culture is like. And even though Indian people are progressing, even though they're becoming more, they remain conservative. So my family was, in fact, more restrictive and more conservative than some of the children my age growing up in India at the same time. I love what Harvey Milk says about coming out. I think there are many closets that we come out from. My first closet was really coming out as a brown person, like when I was 8 and ridiculed in elementary school for being brown, suddenly in a white world when I moved to America. Like I tried to be as white as possible. For 10 years, I forgot that I was brown. And when I was 18, I had to come out of the closet as being South Asian. So at the age of 26, when life was what I thought everything it was meant to be, you know, the great job, the beautiful girlfriend, the person I thought I was going to marry, you know, just all of life seemed perfect. And yet I was unhappy. I didn't know why. And then I discovered through a movie, really, that I was gay. And I was like, oh my gosh, where do I go with that? What do I do? So I had to discover what it meant to be gay. And being South Asian and not really having the skills or the tools or the practice of talking about sex, I couldn't really talk about it with friends or, you know, adults. Like I didn't know where to go with this. And even though I'd quit my job, even though I was like confused, I wound up going back to the same company where I had worked because I got a great job opportunity to move back to India and open an office for us. And my father and mother were so delighted. They were so happy. My parents had actually moved back to India. What they didn't know is that I had to go back into the closet, right, in order to have that life. In India, where there's, you know, where there was Indian section IPC 377, you know, I was terrified. I didn't want to be arrested in India for sodomy. So I went back into the closet, and that was torturous for me. So of course I drank more. And even though I lived in Manhattan all those years, even though I had access to everything, I didn't actually start doing drugs till I was in India and had gone back into the closet. Sort of every good Indian boy is either a doctor or an engineer. And so like I was sort of groomed along that path, whether that I wanted to do that or not. There was a formula laid out for my success. You know, for example, when I told my father that I was gay, he was really confused, like, okay, now what do you do? Like, one of the things he said to me was, the best thing I ever did was marry your mother. Like, that's the formula for success. It's an age-old traditions, thousands of years policy of, you know, get married, you raise a family, this is the model. And like, have a wife and kids, but do what you need to on the side. And I was like, Dad, I can't do that. Then he's like, don't tell your mother, she'll be really hurt. So I didn't tell her. In the year 2002, I had gone to Sydney, Australia for the Gay Games to race sailboats. And, you know, through a series of unfortunate events, emotional challenges with friends and peers, you know, I just chose to, instead of deal with my feelings outwardly, drink more. So I wasn't as careful around condom use on that trip. When I came back to San Francisco, I did an HIV test and I was HIV negative, and I was so relieved. So I actually joined Alcoholics Anonymous in 2003 with the intention of, okay, I'm going to stay negative. After having been in AA for 3 months, I had another HIV test, and they told me that I was HIV positive. On one of my trips to India, you know, I had checked with my sister, and, you know, she had said, don't say anything to that. I was like, I'm not doing this. So I called my mother and father into the room, and I said, hey, I need to have a conversation with you about something that's important. I'm HIV positive, and I'm okay. And they didn't know what to say or react. Like, you know, when parents find out about a child being gay, or at least my parents, I think to some degree, were afraid that this could be a consequence. And so that was hard for them to accept. they didn't know how to respond. They didn't have much of a reaction conversation back with me. And when I would visit again, year after year, they wouldn't ask me about it. They wouldn't, like, if someone's got diabetes or cancer, everyone says, how are the treatments? How's the chemo? How's your blood sugar? Like, no one asked me anything. Like, hello, do you remember I told you that I'm HIV positive, that I have a chronic illness? Like, don't ignore the fact that I'm gay. Don't ignore the fact that I'm living with this disease. And so, I didn't know how to bring it up again. So there was one time when I was visiting my family in India and staying at my parents' home, and my mom came into the bedroom where I was staying, and I was like, oh, here's an opportunity for me to let her see that I'm actually HIV positive. So I pulled out my medicine kit. It comes in those little plastic tins with all those little container things. And I opened it up, and I took it out, and I took my medication, and I grabbed it, and I took a glass of water. I took my pills in front of her. I know she saw it. I know she recognized it. And it's amazing to me that they wouldn't ask, they wouldn't think to say, how are you doing? When I did visit again the year later, my mom did once say to me, so are you doing okay? That was her way of saying, health-wise, as it relates to your HIV. She wasn't able to articulate those words. After finding out about my HIV status, I realized that I could be of service to my community and friends. I could help other South Asians who were struggling with these issues of coming out as gay, of struggling with talking about sex. So I started connecting with HIV service organizations in the Bay Area and learning from them. And then when I would go to India, as part of my volunteer work with TRIKONE, I would meet with Indian service organizations that were providing care and services to people who were affected and impacted by HIV/AIDS. And then as my friends found out that I was doing these things, they would occasionally refer other Indian men or South Asian men to me who were infected with HIV as a resource. I wanted to create a safe place for people to talk about this without shame, without judgment, and to recognize that you can live a healthy and happy life. TRIKONE is the oldest LGBTQ South Asian organization of its sort. It was founded here in the Bay Area by some friends who recognized that people here had the option, here in the Bay Area, had the option of being out and proud, but people around the world did not. So they wanted to create a safe space, a community, a place where people could feel a sense of belonging. TRIKONE started out in some ways as a publication, a magazine, and it became a lifeline for many people around the world. So if I look at sort of how I feel like I present or represent in my community, I feel like I'm one of the few who's willing to be out and proud about being gay, about being HIV positive, about being kinky, whatever. And most of my peers, my South Asian queer peers, are much more private about these issues. And that sense of privacy and secrecy actually causes more problems in terms of HIV and the epidemic. So I'm willing to have those conversations with people. And some people make fun of me for that. Some of my South Asian peers are like, oh, he's a little too forward, he's a little too racy, he's a little too whatever. But actually, it's a way of me letting them know it's okay to be those things. It's okay to talk about it freely. We don't have to follow those restrictions of our cultural backgrounds where we don't talk about sex.